Okay, so I'm going to show y'all how to backfill the bladder when you're in the OR. So first, your scrub tech is going to hand you a bowl and a clamp off of the sterile field, and then you're going to go get a couple of supplies from the center well. You're going to need a liter bottle of normal saline. You'll grab about 3 50 ml syringes, one 10 ml syringe with a blunt tip needle at the end, and then you're going to pull 1% methylene blue from the Pyxis. This is the methylene blue we're going to use. It's not the kind that we stock. This is just expired. You can use it for the video. Okay, so what you're going to do is we're going to open all of our syringes. Typically, you're going to ask the physician how much they want you to backfill the bladder with. It's usually about 180 cc's. So having the 3 of these just kind of makes it easy so you're not constantly refilling them. All right, so you're going to take your 1 liter bottle of normal saline. You will draw up your 10 mLs of methylene blue. Like I said, it will not be this glass vial. All right. You're going to inject this into the liter of normal saline. Close your lid, gently kind of mix it all together. And then we are going to pour about, just so you can keep track for your charting purposes, I personally pour about 250 to 300 cc's of saline in here. We're going to set this to the side in case we need more. Okay, so you're going to go over to the table and one of the physicians will hold the drape up for you and you're going to kneel down on the side of the bed. This is where you're going to take the clamp that the scrub tech has given you. And this is very important. You're going to clamp right below the port because this is what's going to prevent it from going into the bag and is going to backfill the bladder for you. So you have 2 ports here. It is very important to not fill this port because this is what you have filled the balloon that's keeping the Foley in place. This is the port that we are going to backfill with the solution. So we're going to draw up our 50 cc's. Okay. So you're going to come down here. Your Foley is clamped. This is in a very weird spot. Ooh. You are going to screw in the lure lock. And you're going to inject this 50 mLs. This should not be hard. If you are needing tension, you need to stop and make sure that you're in the correct port. So now that this is in, you're going to tell the team, okay, that's 50 cc's in. You're going to grab your next one, screw it on. Same thing, you're going to screw this in, push this in rather. You're going to tell them that's 100 cc's in, and we'll do this just for the sake of time. But like I said, you'll ask them how much they want you to backfill with. So when this is in, you're going to say, okay, that's 150 cc's in, and they're going to say, okay, that's great, we've been able to visualize what we need, and you can deflate it. So what you're going to do is this will be down on the ground. You're just going to unclamp this, and in a real bladder where this is actually high enough, all of this methylene blue is going to backfill into the Foley and drain from the patient's bladder. So you're then going to be done. Be sure, remember, the clamp and the bowl are from your scrub tech's tray, so keep track of those. You're going to need those for your counts and to put back with the tray at the end of the case. Also important just to make sure anesthesia knows how much you backfilled the bladder with because they'll have to subtract that from their eyes and nose at the end of the case. And that's it.